So the next phase of hip arthroscopy starts around the 8-week mark with some more dynamic and plyometric exercises. And then at the 12-week mark, we like to try to start some gentle return to sport activity or simulation of that activity. So some examples of the first portion of that would be some increased height step-ups. So again, Emily's affected leg would be the left leg. So what I'm going to ask her to do is she's just going to take that left leg and step up on that box. And then she's going to lower herself back down, keeping the left leg on there. We're watching for compensation of dropping the knee in, which puts undue stress on the knee and undue stress on the hip because it takes it out of line. So I would ask her to do a few sets of 10 of those. We would also do a sideways step up. Same thing, we're looking for any type of compensation of that knee falling in. We're really wanting to activate that glute med and keep that hip in an external rotation as she steps up. We would have her do a few sets of 10 on those. Next, I would progress her to a forward jump down, working on that landing position, keep making sure the knees are in a good position and not caving in, and that she's not shoving the knees too far over the toes. I would have her do a few sets of 10 of those also. If she's having a hard time with that, I could give her a cue of as she jumps down. If she's not squatting far enough, I would roll this here and just stop her from going too far down or not coming far enough down. Another progression would be a lunge step. So I'm actually just going to have her perform a normal lunge right now. Just sending that left leg forward, pressing through the heel as she goes back up. Same thing, we're watching for making sure that that knee is not immediately caving in, putting undue stress on the knee and the hip, and that she's not stepping that knee too far forward. Once she gets better at those and they become a little bit more easy, we can make that unsteady by having her do a lunge onto the Bosu ball. Same thing, I'm going to ask her to push her weight back through her heel. Next, we would work on a deeper squat progression. So once she's gotten better at squats, and we would like to make those a little bit more dynamic, we can do what's called a Bosu squat. So she's just going to step on this to give her an unsteady surface, and she's going to drop down into a squat, trying to hold her balance on the Bosu ball. In same cues as before, she's just sitting straight back, trying not to let the knees go too far over the toes. I would ask her to do a few sets of 10 of those also. We can progress those a little bit more by having her change her the width of her feet as she gets a little bit more proficient in those. That's usually in the 8 to 12 week time range after surgery, and then starting in the 12-week period, we would start to go more into a sport specific. So depending on which background of sport you're coming from, we would start to go back into a jumping phase for basketball players. We can get more into running for all sports, and just make those more sport specific per patient, depending on what sport they're coming from.